Have you ever wondered why some of the deadliest diseases go undetected until it's too late? Pancreatic cancer is one of the most aggressive and silent killers, often going unnoticed until it has reached advanced stages. By the time it's diagnosed, nearly 80% of cases are already quite advanced. Globally, over 495,000 people are diagnosed each year, and it's responsible for more than 466,000 deaths annually. Nearly one person every minute, according to the World Health Organization. But what if you could recognize the warning signs early? Today, we'll break down the top 15 symptoms of pancreatic cancer, all backed by medical studies and expert-reviewed journals. Some may surprise you, others may cause you to pause and reflect. And don't miss symptom number 14. It's one of the most overlooked clues that could change everything about early detection. Our goal isn't to scare you, but to empower you with knowledge. The earlier you recognize these signs, the greater the chance of survival. So, if you're committed to prioritizing your health, hit that like button and subscribe for more science-backed health content every week. Let us know in the comments where you're watching from. We love hearing from our community. Remember, this content is for informational purposes only and not a substitute for medical advice. If any of these symptoms resonate with you, consult a healthcare professional. Now let's dive into the symptoms you need to know. First up, abdominal pain. Pain in the upper abdomen that radiates to the back is a classic symptom of pancreatic cancer. This discomfort often intensifies after eating or when lying down and may be relieved by leaning forward. The reason? Tumors pressing on or invading nearby nerves and organs, leading to a deep gnawing sensation. A study published in the Journal of Gastrointestinal Surgery found that patients with more severe abdominal pain had a much lower median survival, only 9 months compared to nearly 29 months for those without pain. If you're experiencing persistent abdominal pain, especially alongside weight loss or jaundice, seek medical evaluation. Next, loss of appetite. Imagine sitting down to your favorite meal, but the thought of eating makes you feel sick. The pancreas is vital for digestion, producing the enzymes that break down food. Cancer can disrupt this process, leading to malabsorption and a feeling that eating is pointless. Tumors can also release substances that hijack your hunger cues, making you feel full when you haven't eaten. A 2019 study found that up to 85% of pancreatic cancer patients experienced significant weight loss, often tied to decreased appetite and malabsorption. If your appetite has vanished, don't ignore it. Bloating is another symptom that shouldn't be dismissed. While occasional bloating is common, persistent or unexplained bloating can be a warning sign. Research from the San Francisco Bay Area found that 25% of pancreatic cancer patients reported unusual bloating, compared to just 2% of healthy individuals. Pancreatic tumors can disrupt digestion, causing food to remain in the stomach longer and resulting in that uncomfortable, swollen feeling. If bloating lingers without a clear cause, talk to your doctor. Indigestion may seem harmless, but when it persists or worsens, it could be a red flag. Tumors can press against the stomach or small intestine, disrupting digestion and causing food to linger. A study in BMJ Open found that people with indigestion, especially without heartburn, had a nearly 4 times higher risk of pancreatic cancer. If indigestion doesn't respond to usual remedies or is paired with weight loss, don't wait to get checked. Diarrhea is another sign your pancreas may not be working properly. When the pancreas can't release enough enzymes, your body struggles to absorb nutrients, and food moves through too quickly. Persistent, hard-to-control diarrhea was the only clue leading to a pancreatic cancer diagnosis in one study. If this symptom is new for you, especially if it won't go away, consult a medical professional. Fatty stools, pale, greasy, or floating, can also be a warning sign. This happens when the pancreas isn't producing enough digestive enzymes, leading to poor fat absorption. Research published in Nutrition and Clinical Practice found that losing over 90% of the pancreas's exocrine function can lead to these changes. If you notice such stool changes, get it checked out. Constipation can also be linked to pancreatic cancer. Cancer or its treatments, especially pain medications, can slow digestion. A recent study in Frontiers in Oncology found a potential causal relationship between persistent constipation and an increased risk of pancreatic cancer. If constipation is ongoing and accompanied by other symptoms, don't ignore it. Muscle wasting, or the loss of muscle mass and strength, is another symptom that often precedes diagnosis. A 2023 study in Nature Communications found skeletal muscle loss could be detected up to 18 months before a pancreatic cancer diagnosis. Tumors can release substances that directly cause muscle breakdown. This isn't just about feeling weak. It's a significant factor that affects the quality of life and treatment outcomes. Pale or grayish skin, often due to blocked bile ducts and a buildup of bilirubin, is a classic sign, especially if the tumor is in the head of the pancreas. Jaundice and pale-colored stools or dark urine often go hand in hand. These changes should never be ignored, as early recognition can significantly improve outcomes. Sudden onset diabetes, particularly in people over 50, can sometimes be an early sign of pancreatic cancer. The pancreas is responsible for insulin production, and tumors can disrupt this, leading to elevated blood sugar. Research indicates about 0.8% of individuals over 50 with new onset diabetes may have underlying pancreatic cancer. If you're newly diabetic and experiencing other symptoms, consult your provider. Blood clots, especially those that form in unusual places or recur, can be an early clue. Known as Trousseau's syndrome, this is a result of the cancer making your blood more likely to clot. A recent study found that 4.2% of pancreatic cancer patients experienced venous thromboembolism before diagnosis. If you develop an unexplained blood clot, especially without typical risk factors, get evaluated promptly. Itchy skin can signal more than a surface problem. Tumors that block bile ducts can cause a buildup of bile acids, leading to relentless itching. New research highlights the role of specific enzymes and compounds in this process, explaining why typical antihistamines often don't work. Effective relief focuses on resolving the underlying blockage. Fever can sometimes be an early clue, even without infection. This immune response, called neoplastic fever, may be the body's reaction to the tumor. In a documented case, fever resolved completely after surgical removal of the cancer. While not common, persistent, unexplained fever, especially with other symptoms, should be investigated. Fatigue stands out as one of the most prevalent and underestimated symptoms. This isn't just feeling tired, but a deep exhaustion that disrupts daily life. A study in Italy found that 94% of pancreatic cancer patients reported fatigue during chemotherapy. Factors like anemia, weight loss, and even smoking can make it worse. Addressing fatigue is crucial to maintaining quality of life. Finally, general malaise. Feeling persistently unwell or unusually tired without a clear cause is often dismissed. However, studies from Denmark and the UK highlight that malaise is a common and significant early symptom of pancreatic cancer, especially in those over 60. If you experience ongoing, unexplained discomfort, consult your healthcare professional. So what can you do to protect yourself? Recognize these symptoms, prioritize regular checkups, and listen to your body. While many of these signs can be caused by other, less serious conditions, their persistence, especially in combination, warrants attention. Your health is your greatest asset. If you found this information helpful, type "helpful" in the comments. It really encourages us to continue providing clear, science-backed health content for you. And remember, sharing knowledge saves lives, so share this with someone who might need it. Stay curious, stay proactive, and take care of your health, one insight at a time.